Every 40 seconds, someone suffers a stroke, and most never see it coming. It doesn't scream, it whispers until it's too late. But the truth is, your body often does warn you, sometimes weeks in advance, through subtle changes in speech, memory, balance, even energy. And knowing those signals could be the difference between recovery and regret. Doctors now recognize 9 early stroke symptoms that can appear up to a month before the event, along with 9 powerful prevention tips that could save your life or someone you love. The real question isn't, will I have a stroke? It's, will I catch the signs in time before everything changes forever? Stick with me, because the second symptom is one most people dismiss, until they wake up on the other side of a life they can't get back. 9 early stroke symptoms.
It's so important to recognize the early signs of stroke because the earlier you get to the hospital, the greater the chance that you will recover fully from a stroke. I'm going to give you some easy tips on how to recognize the early signs of stroke. All you have to remember are 2 words. Be fast. B is for balance. People who've had stroke may feel weak and dizzy. E is for eye. Some people see blurry or double vision. F is for face. Some people may feel that their face is weak, or you may notice that their face is droopy. A is for arm weakness. If they can't grab a cup, or they just can't even shake your hand. S is for speech. You may notice that they're not speaking the way they used to speak.
Number 1. Sudden confusion or memory problems. If you've recently found yourself walking into a room and forgetting why, or struggling to follow a familiar recipe, it might not just be tiredness or age. Sudden confusion or memory lapses, especially when they appear without any clear cause, can be your brain's quiet cry for help. This happens when blood flow to certain parts of the brain slows down, affecting how well you think, focus, or remember. You may feel like you're in a mental fog, or notice it's harder to make decisions you once handled easily. These small slips often go unnoticed, shrugged off as stress. But they could be the early signs of a stroke, showing up weeks before the real crisis hits. But what happens when your body starts losing feeling too? Let's spot the next hidden danger. Number 2. Numbness or weakness, one side. You wake up, and your arm feels numb. Not just asleep, but oddly lifeless. Later, you notice your smile looks uneven in the mirror, as if one side of your face refuses to cooperate. It fades, so you brush it off. But this is exactly what many people do. Ignore the first cry for help from their brain. Sudden numbness or weakness, especially if it hits only one side of your face, arm, or leg, isn't just a random glitch. It could mean your brain is struggling to get enough blood. A blockage might be forming, slowly starving part of your mind. And once that damage sets in, there's no reversing it. But it's not just touch you should worry about. Your sight might betray you too. Let's reveal the next silent sign. By the way, where are you watching this video from today? Drop your city or country below and tell us if stroke awareness is strong where you live. Your story could inspire someone to take action. Number 3. Vision changes, blurred or double. Blurry vision, double vision, or brief moments where you can't see clearly might seem harmless at first. You may blame it on tired eyes or screen time. But these small disruptions could be signs that blood isn't reaching the part of your brain that controls sight. When this happens, your brain is struggling. Something is blocking or reducing blood flow, and it's trying to warn you. These changes don't always last long, which is why many people ignore them. But even a few seconds of visual distortion can be the brain's early cry for help. But the next symptom? That could seriously leave you stumbling without warning. Let's see how your balance gives you clues. Number 4. Loss of balance or gait issues. If someone starts feeling dizzy for no clear reason or finds themselves stumbling more than usual, it's easy to blame fatigue or aging. But if walking suddenly feels off, like your legs aren't obeying your brain or you're swaying as if the ground is uneven, these small changes can be early signs of a stroke. Some people describe it as walking like they're drunk, even without touching a drop of alcohol. These symptoms can appear weeks before a major stroke hits. They often come and go, fooling people into thinking it's nothing. But when your body starts losing control over something as basic as balance, it means the brain is already in trouble. It's a quiet alarm few recognize in time, and once your steps start to fail, the next warning may be even easier to miss. Because next, your mouth might start telling on you, one slurred word at a time. Number 5. Speech or comprehension difficulties. Slurred speech that seems to come out of nowhere, saying the wrong word even though you know the right one, or suddenly struggling to understand a simple sentence. These aren't just slips or signs of being tired. That's the sign that blood flow to the language center is starting to falter. This part of your brain helps you form and make sense of words. When it's in trouble, your speech can sound off, or you may feel like your mind is foggy during a conversation. Don't ignore this, thinking it's stress or distraction. These small changes can point to a stroke that's on its way, sometimes as early as a month before it strikes. If your speech gets tangled, don't brush it off. Act fast. But sometimes, the warning hides deep in your energy levels. Let's spot the exhaustion sign next. Number 6. Excessive fatigue. If you've been feeling drained every day, even after full sleep, and can't explain why, you shouldn't ignore it. This kind of exhaustion isn't just about being tired. It can happen when the brain isn't getting enough oxygen or blood, quietly struggling without any loud warning. You might notice your thoughts slow down, or that everyday tasks feel heavier. That's not laziness. It could be your brain in distress. It often starts this way, a silent fight inside your body, weeks before a stroke hits. When your energy crashes hard, your brain may be waving a white flag. But the next signs show up in tiny hand mistakes most people ignore. Let's catch them early. Number 7. Motor coordination changes. If your hands keep dropping objects, or you fumble while buttoning a shirt, it's not just carelessness. These slips could mean your brain isn't sending clear signals to your muscles. You might notice your handwriting getting worse, or your foot dragging slightly when you walk. These are often brushed off as tiredness, but they may point to early nerve misfires, a sign that a stroke could be forming deep within. Even pouring water into a glass or unlocking a door can suddenly feel confusing or awkward. It creeps in quietly, masking itself as aging or stress. But it's not random. It's your brain struggling to control the body like it used to. And while this quiet breakdown goes unnoticed, another warning could be louder, sharper. When small tasks feel big, your brain's in trouble. But pain can shout even louder than clumsiness. The next signal could hit your head hard. Number 8. Unusual headache. A sudden headache that feels different from your usual ones, sharper, stronger, or striking out of nowhere, can be an early warning sign. This isn't just a regular ache from stress or lack of sleep. It might mean a blood vessel in your brain is getting blocked or even starting to burst. Some feel pressure building behind their eyes, others describe it like a lightning bolt. And while painkillers might offer short-term relief, they don't fix the real danger growing inside. Not all headaches are harmless. Some mean a crisis is coming. And one hidden danger can build silently for years before exploding. Let's uncover it now. Number 9. Uncontrolled high blood pressure. High blood pressure quietly damages your blood vessels day by day. You won't feel it, but it's there, slowly weakening the walls inside your brain. A stroke may seem sudden, but your body often whispers warnings weeks in advance. Subtle signs like sudden dizziness, blurry vision, slurred speech, or weakness on one side of the body may appear and then disappear. These are not just random spells, they're small blood flow failures in your brain. If ignored, the next one might be permanent. Many confuse these early symptoms with fatigue, stress, or age, brushing them off until it's too late. But the truth is, these moments are signals, your brain pleading for help before the real damage hits. Pressure building up is a ticking time bomb. But don't worry, there are smart, doctor-approved ways to fight back. Let's dive into 9 life-saving tips you can start today.
In order to prevent stroke, we tend to say that 80% of strokes can be prevented by managing risk factors. And so that should really start early in life. And that includes healthy diet, exercise, not smoking. If you know that you have a family history of high cholesterol, stroke, heart disease, you want to get these things tested early so that you can make sure you're either on the right diet or the right medications to prevent high cholesterol or diabetes. And the earlier you manage these risk factors, the less likely you are to have a stroke. I always say that if everyone managed their risk factors from an early age, stroke would be a much less prevalent disease in the US and the world.
9 doctor-approved prevention tips. Number 1. Monitor blood pressure at home. Your blood pressure can quietly rise without warning. No pain, no symptoms, just damage silently building inside your body. High blood pressure is one of the leading causes of strokes and heart attacks, yet it often goes unnoticed until it's too late. That's why checking it regularly at home is not just a habit, but a powerful shield. Use a reliable monitor, sit calmly for 5 minutes, and check your pressure twice a day. Track the numbers. If they trend higher than 120/80ths, take action immediately. Early detection means your doctor can step in before a crisis happens. Many lives are lost simply because a silent number was never checked. It's easy, it's cheap, and it could save your life. Pressure caught early can be life-saving. But what you eat every day matters just as much. Let's clean up your plate next. Number 2. Lower salt intake, under 5 grams per day. Salt hides in almost everything: bread, chips, sauces, frozen meals, and every excess gram makes your blood pressure rise higher. When you eat more than 5 grams of salt a day, about a teaspoon, your blood vessels stiffen, your heart strains harder, and your stroke risk climbs fast. Lowering salt can quickly ease that pressure. Start reading food labels, cook more at home, swap salty snacks for fruits or nuts. Taste buds adjust. Give them 2 weeks and low-salt food will begin to feel normal. Cut back slowly, and your blood vessels will thank you. People often focus on sugar but ignore salt, even though salt may be silently doing more harm. So, less salt, good start. Now let's control the sweet side of danger too. Your blood sugar holds big clues. Number 3. Control blood sugar. Even small spikes in blood sugar can damage the inner lining of your blood vessels. When your blood sugar is too high too often, your body starts to struggle. Nerves weaken, vision blurs, kidneys falter, and your brain faces higher stroke risks. Both prediabetes and diabetes significantly raise this danger. You don't need to wait for a diagnosis to act. Check your blood sugar, especially after meals. Stay away from refined carbs like white bread, soda, and sweet snacks. Choose whole grains, vegetables, and proteins that keep your sugar steady. Exercise and sleep also help regulate it. Remember, if your blood sugar swings wildly, you might not feel it, but your arteries do, so don't wait for symptoms. Balance it now to protect your brain and body, but now your whole body needs a boost. Time to get moving the smart way. Number 4. Exercise regularly, 150 minutes each week. A still body invites disease, while a moving one builds strength. Just 150 minutes of moderate movement each week, walking, cycling, swimming, even housework, can make a difference you feel, and one your heart feels even more. Exercise pumps more blood through your brain, improves memory, and strengthens arteries so they don't clog or burst. It also reduces stress hormones, which themselves can damage your heart if left unchecked. Break it into short sessions, 30 minutes, 5 days a week. The goal is to build a habit, not hit a record. Once you feel the energy return, once you sleep better, you'll want to keep going. Sitting is the new silent killer, so don't sit still too long. Stronger muscles mean a clearer brain, but hidden weight gain still puts you at risk. Let's tackle it head on. Number 5. Control weight. Extra weight isn't just about how you look. It changes how your body works. Fat cells, especially around your belly, release chemicals that inflame your arteries, raise your blood pressure, and make your blood sugar harder to control. Even a small weight loss, just 5 to 10% of your body weight, can dramatically improve your health. You don't need extreme diets. Eat whole foods, drink water, and walk daily. If your clothes fit better, you're heading the right way. Weight loss also improves sleep, energy, and mood, making everything else on this list easier to do. Don't chase fast results. Aim for slow, steady progress. The less weight your body has to carry, the longer and better it can carry you. But still, your nighttime breathing might still hurt you. Let's fix it. Number 6. Address sleep apnea. You might think you're sleeping peacefully, but if you snore loudly, feel tired all day, or gasp for air at night, your brain might be starving for oxygen while you sleep. Sleep apnea is when your airway repeatedly blocks during sleep, causing your oxygen levels to dip and your blood pressure to surge. Over time, this strain damages your brain, heart, and blood vessels. Untreated sleep apnea is a major hidden cause of strokes. A simple sleep test can reveal if you have it. If you do, using a CPAP machine or making weight loss and sleeping position changes can fix the problem. It's not just about better rest, it's about protecting your brain every night. Now, we guard your blood pipes from the inside. Cholesterol control is key. Number 7. Manage cholesterol, especially LDL. Cholesterol builds up silently inside your arteries like sludge in a pipe. Over time, the bad kind, LDL cholesterol, hardens into plaques that block blood flow or break off, causing clots that can travel to the brain. That's how strokes happen. Lowering LDL isn't just a number game, it's prevention at its core. Avoid trans fats, fried foods, and processed snacks. Choose fiber-rich foods like oats, beans, and veggies. If lifestyle changes aren't enough, your doctor may suggest a statin. Don't fear the medicine, fear the clot. A clean artery gives your brain the oxygen it needs and keeps your heart beating safely. You might not feel clogged arteries, but that doesn't mean they aren't there. But there's one more nasty habit that must go now. Let's crush it next. Number 8. Avoid smoking. Smoking poisons your blood vessels. Every puff stiffens arteries, raises blood pressure, and thickens your blood, making it easier for clots to form and strokes to happen. Even if you've smoked for years, quitting now instantly begins to heal the damage. Within weeks, your circulation improves. Within months, your stroke risk drops dramatically. Nicotine is addictive, but the grip weakens with time and support. Use patches, gum, or talk to your doctor about quitting tools. The benefits are not just in the future. They start within days. If you've tried before, try again. The sooner you stop, the longer you live. And now, one last check could be your hidden lifesaver. Let's do it. Number 9. Check for heart arrhythmias, like atrial fibrillation. Common kind is atrial fibrillation, and it often comes without any warning signs. But it quietly increases your stroke risk by as much as 5 times. That's because these irregular beats can cause blood to pool and form clots, which can shoot into your brain. A quick check at your doctor's office, or even a smart device that tracks your heartbeat, can spot it. If caught, simple treatments like medications or procedures can stop the risk from growing. You don't have to feel anything wrong to be in danger, and that's why checking matters. So, you see, your body speaks, only you need to know how to listen. Catch the early signs, follow the doctor-approved tips, and protect your brain, your body, and your future. Which symptom or prevention tip surprised you the most? Let us know in the comments below. And don't forget to hit subscribe, so you never miss more life-saving tips like this. Thanks for watching.